Like we mentioned before, this type of diabetes makes just about 5 to 10% of the reported cases of diabetes, which means it is not as common. But it is interesting to note that it is more common in Caucasians as compared to African Americans or Asians. It is as common in men as in women. It usually starts under the age of 20, hence the name juvenile diabetes, but it can really happen at any age. What causes type 1 diabetes? This one is insulin-dependent diabetes, which means that people suffering from this form of diabetes have to depend on external insulin, as their bodies are unable to produce it at all. It happens because the body's immune system attacks the part of the pancreas that produces insulin. The immune system views the cells that produce insulin as foreign invaders and attacks them. The most puzzling part is that scientists are still not sure as to why it happens. That is the reason why it is termed as an autoimmune disease. The insulin-producing cells are called islets, and their responsibility, including sensing the glucose in the blood and then producing the necessary amount of insulin, which can help in normalizing the sugar levels in the blood. Insulin is the key to open the cells and allow the glucose to enter, which means that the glucose is now ready to be used as fuel by the body. When there is no key, it means that the sugar stays where it is and keeps building up in the blood. This means that the glucose doesn't reach the body's cells, which starts starving. The high level of blood sugar, if not brought under control, can lead to damage to the eyes, kidneys, nerves, as well as the heart. It can even lead to coma and death. How is type 1 diabetes diagnosed? The diagnosis for type 1 and 2 are common in terms of sugar levels in the blood. The tests are also the same. The only difference is that type 2 diabetes is characterized by high blood glucose in the context of insulin resistance and relative insulin deficiency, while type 1 is when there is an absolute insulin deficiency, as it is not produced by the cells which are supposed to. Is there a way to prevent type 1 diabetes? As of now, there is no cure or no way to prevent it. Taking external insulin is the only way out. What is the treatment of type 1 diabetes? It is imperative to take insulin injections in this type of diabetes, which is the only way by which the disease can be kept under control, but not treated. But how much insulin should be injected into the body is a very important thing to be monitored, as it is different for different people. The amount of insulin to be given is based on factors like the diet of the patient, the amount of physical exercise the patient undergoes, the stress the person is under, the general health of the person, whether or not they have any other disease. The proper dose of insulin to be taken is a very delicate issue, which has to be done with optimum care. It's a balancing act because if too much insulin is taken, then the body starts burning too much glucose. This means that the blood sugar can dip to dangerously low levels. If the insulin taken is too less, then that means that the body is being deprived of glucose and energy. The blood sugar in this case can rise to dangerously high levels, which can even threaten the patient's life. So that's a lot in detail about type 1 diabetes. Now, let's get into the details of type 2 diabetes. Stay tuned.